South Africa's test positivity for Covid-19 from below 5% to more than 9% has researcher Ridhwaan Suliman perplexed. Now he joins us now for more on this week's Covid-19 data. A very good afternoon to you and thank you so much for joining us.
Good afternoon, Kira. Thank you for having me.
Now just talk to us about why this information is perplexing you.
Well, what we saw yesterday was a jump in the test positivity rate to 9.2%, and that increased after consistently being below 5% for the past 3 weeks. So certainly an anomaly, also something that's not quite expected. While the increase is expected, it's the stark increase that was unexpected. Noticeably, the test positivity measure being a proportion of positive tests to total tests conducted, the number of tests reported yesterday was noticeably lower than averages over the past few weeks.
And if we come back to the average of the daily COVID-19 cases, just in the past week, both nationally and a provincial breakdown, what did those look like?
So unfortunately, we're starting to see an uptick in the number of reported cases and early signs of what I could possibly call an Easter wave driven by resurgences in the smaller provinces. So nationally, we're reporting 1,160 new cases on average per day over the last week. And as you can see at the bottom right graph, that's an increase of 35% week on week. So the increase, as I mentioned, is driven by resurgences in 3 of the 9 provinces and the smaller provinces. It's likely a reflection of events from 2 weeks ago. Therefore, the Easter long weekend, we're starting to see the effects of that. Hopefully, we can try and get these under control before it spreads further into the populous provinces, and hopefully it's not the start of a possible third wave.
And Ridhwaan, what are these 3 leading provinces?
So Northern Cape is of concern. The last week, the number of reported cases have increased by over 100%. And also, currently, the incidence rate is at 40% of the peak that the Northern Cape saw at the peak of its second wave. So it's very much in a resurgence. One could argue that it hasn't quite gotten over the second wave, so a surge on top of the previous surge. Then the Free State has shown an increase of 67% compared to a week ago. And its incidence rate currently is at 35% of the peak of its second wave peak. So the Free State has also entered a third wave. The Northwest too has increased by 57% compared to a week ago, and the incidence rate in the Northwest is at 18% of its peak. So not quite entering a third wave, but heading in that direction.
And winter's actually creeping up on us, with this weekend actually seeing a lot of the provinces in the country actually experiencing their coldest temperatures, or the lowest drop in temperatures rather, that they've actually experienced so far this year. Ridhwaan, let's talk about the average daily tests that have been carried out. Are we seeing an increase in the number of tests the country is conducting?
Yes, we are seeing an increase this past week. We are conducting an average of 27,000 tests per day nationally. That's over the last week, and that's an increase of 19% compared to the previous week. The increase is one expected because the previous week had public holidays, including the Easter long weekend. So we were always likely to see an increase in testing this week. But I think on top of that, the increase is also due to an increased demand for testing, with more people presenting for testing, driven again by the resurgence in the smaller provinces.
And how are the hospitals doing in terms of the admission numbers that we're seeing?
So the last week saw just under 1,600 new hospital admissions nationally, and that's an increase of 2% compared to a week ago. So a slight increase, and that increase is driven by increases in the Northern Cape, 67% compared to a week ago. In the Free State, the increase is 23%. In the Northwest, 15%. And also in KwaZulu-Natal, unexpectedly, an increase of 16% in new hospital admissions last week.
And why would the KZN increase be unexpected?
Well, we haven't been seeing an increase in the number of reported cases in KwaZulu-Natal. So generally the hospital admissions lag cases. So we would initially see an increase in cases and test positivity rate, thereafter followed by increase in the hospital admissions.
And just lastly, also not something that we really like to discuss that much, but clearly is one of the statistics linked to the pandemic, the number of people that have lost their lives due to COVID-19 related complications.
Yes. So over the last week, the average number of deaths that we're reporting nationally is 65 new deaths per day. And that too is an increase that's an increase of over 50% compared to a week ago. This again is unexpected because we do know that deaths do lag cases and test positivity rates by about 3 to 5 weeks. So I would have expected this to still sort of show a plateau or similar level compared to the previous week. The increase is driven by increases in Northern Cape, 20% increase. The number of deaths in the Northwest has almost doubled compared to a week ago. And unexpectedly, an increase in Eastern Cape, reporting 4 times as many deaths compared to a week ago, as well as Gauteng and KwaZulu-Natal, an increase of 50%. So while the numbers are still relatively low, I think it's unexpected to see an increase in the deaths, currently at just over 60 new deaths per day.
Well, Ridhwaan, thank you so much for joining us this afternoon and helping us to make sense of all of these numbers and the data coming in on a weekly basis relating to the COVID-19 pandemic. That was a CSIR Senior Researcher, Ridhwaan Suliman.